Good morning, everyone.
Good morning.
It is exactly 11 o'clock, and so even though the world is changed and the ground underneath us is not the same as it was last week, we are BOS, and we start on time, and we charge through thick and thin. So thanks for joining us today for what we're calling the COVID-19 Response Weekly Meeting. So I know some folks are on the call and may not have the PowerPoint in front of them. So I'm just going to verbally walk us through the agenda. And those of you who can see it on the screen will just follow along. So welcome. Introductions we'll do by just saying if you're on Zoom, you can see who's logged in. And if not, then it's many of our friends that we're used to seeing in person. The format is similar to last week's, which is an update from DMIS, DOH, CCEH. Then we've got some on-the-ground providers who are going to give us some of their strategies that they've developed on the fly from BH Care and Reliance House. We'll have Housing Innovations walk us through the HUD and COC updates, do some takeaways, and then next steps. So I will say that any of the folks who are presenters, if you would mute yourselves when you're not speaking, that will minimize the feedback for folks. So put yourselves on mute or I'll start calling you out. All right, can we advance the slides? So that's the agenda that I just walked through. If you'll go to the next slide, and Demas will provide, oh, sorry, announcements. I jumped through announcements. So we do have some announcements. The responses from last week's meeting are posted on our website, www.ctbos.org, and we've got a special place for COVID resources. Again, please let us know how we can help you as you do your work. We're here trying to provide as much support as we can in whatever way we can, even if it's to remind you to breathe, right? So we'll do that exercise a little later. And then we did put out a vote on new project priorities. There was some question as to whether we would continue with that vote. At this point, not knowing when the world will go back to normal, we are asking that that vote continue to be made by close of business today. We've got 10 votes in and 1 abstention. We just need 2 more votes to pass those new project priorities. We've got a couple more announcements. There are some webinars that are being held. The one is on addressing, and I just lost that slide for the people. So it's addressing eviction, there we go, eviction and discrimination concerns. That's going to be on Thursday, April 2nd, which is a CCEH webinar. And then we've got another webinar with our Canadian friends at the Canadian Alliance to End Homelessness with Ian DeJong that many of us know, and he's going to be providing some strategies for outreach and support to unsheltered homeless. So we encourage folks, we know you're busy doing the work on the ground, but if one of your staff can take time to get on those webinars, that would be great. So those are the announcements. And now we'll go to an update from Demas with Alice Minervino.
That's my boss.
Thanks, John. Thanks everyone for joining us. I will probably keep our comments very brief. Just so everyone knows, the commissioner sends out, I think it's almost daily now, provider announcements. They're on our DEMIS website under the COVID-19 response. There was a brief put out yesterday regarding admissions to programming and different criteria that have been modified during this time. So, you know, if you're working with folks that are maybe going to treatment or something and you're curious about, or just curious about resources, there's information in the info brief. There's information related to the stimulus package in the info brief from the commissioner. I was on a call. You know, time is very relative right now with everything that's going on. So I think it was earlier this week I was on a call, and many of you were also on the call with Senator Blumenthal, where he discussed the small business loan administration loans that are going to be available. And so for those of you who report to upper management and your agencies, or, you know, have a good relationship, you know, you might want to talk with your management about, you know, applying for some of the small business loans that will be available. We are continuing, I know a lot of folks are working from home. We're continuing to try and make sure that we're monitoring, you know, the work we're doing with clients, making sure that people are somehow getting support if they need it, whether that's telephonically, if it's computer in some ways. There's also some information on CT BOS related to the track phones and the state issued phones that might be helpful to your clients about accessing more data, more minutes, etc. And there's also information related to the folks who are receiving Husky, and that DSS is not having people's redeterminations be due in the next, I believe they're not going to be due until June or July at this point, so people will not lose their medical insurance. So just wanted to let everyone know, you know, our website has some great resources. CT BOS, of course, has some great resources. Department of Social Services also has some resources. So those are kind of my updates in a nutshell. I think Brenda Earl might be on the call. If she wanted to add anything, I'd open that to her now.
Sorry, this is Brenda. The connection's really bad. Can you hear me?
Yes.
Yes.
Okay.
Yeah.
I can just quickly add around outreach. I know we're currently reaching out to all of our past programs to really see what's going on the ground, in addition to other DEMIS outreach, to see what needs there are around staffing and really visiting encampments and supplies. We're kind of gathering that information now. We're strongly following the HUD and CDC guidance. We're trying to keep encampments kind of intact. I did talk with CCEH this morning. David Gonzalez-Rice kind of confirmed that the mayor's meeting that I think CCEH has been convening, they're going to reiterate to the mayors, the towns, and law enforcement to really push to keep encampments intact. So that's it for, I did also, I'm looking to reach out for Narcan needs. DEMIS got a large order of Narcan in. If you're hearing about any needs out there, certainly send me an email and I could try to coordinate that.
Brenda, it's Kara from BOH. We've
Hey,
been hearing
Kara.
that. Hi, I miss you.
I miss you.
We've been hearing on the ground many of the places where unsheltered folks typically go to shower have been closed or are closing their buildings and only doing like takeout meals. So I would just keep your ears open for that. And if the state has access to any of the portable showers, to kind of make sure people who are unsheltered still have the ability to bathe, shower, and, you know, kind of practice hygiene. That's really important right now.
Yeah, definitely. Thank you, Kara. That's part of our ask when we're reaching out to our outreach agencies. So we're actually collecting information on who has access to portable hygiene, whether it's hand washing stations, bathrooms, and who doesn't. So we are hoping to kind of get like a spreadsheet of need, hopefully by the end of today.
Thank you. Yep.
Great. So we'll move on to DOH, but any of us who are hosts, Lauren, Alice, Shannon, Kara, if you're not speaking, you need to put yourself on mute because we're hearing the sound of this presentation getting fed back into the system. So unless you're actively speaking, I'm gonna ask you to put yourself on mute or have one of the hosts mute everyone except the current speaker.
John, I just asked Shannon to mute all the participants. She has to do it one at a time.
Okay.
So it'll take a couple seconds, but I think it'll help with the sound quality.
Okay.
And now I'm muting myself.
Thank
She's
you.
the owner of the company.
And I will now
Okay.
mute myself and
She's
let
the one who
somebody
started
from
housing
DOH.
innovation, the consulting company.
All right, it's just me talking now, Kara from DOH. Steve and Lee are currently on calls where they are planning with municipalities for what we're calling shelter decompression, which is essentially trying to get many people who are in shelters into hotels so that they can practice social distancing and that we can kind of decrease overcrowding in shelters. Things are changing fairly rapidly by the hour with the availability of funding, how we're going to do this. So just for, I guess, this group's purpose, we're really tied up with that right now. And we're trying to maintain the front end of the CAN system at the same time because we know people are going to continue to fall into homelessness and perhaps even have a surge of homelessness due to unemployment. So just keep your eyes on emails for updates. Please do not encourage anyone to call 211 and ask for a hotel at this point. We've heard that happening a little bit, and we're trying only to focus on moving people out of shelters and do this in a phased process. So again, Lee, Bo, I, Steve, we're all available to answer questions. But again, I think I asked Steve what he wanted me to report on, and he said, give an update on the chaos. And it's exactly what's happening at DOH right now. That's
Great,
it.
thanks. Just to
Someone just said in question into the chat box to get the email contact for the Narcan. Could whoever has that type that into the chat box? If you don't know how to chat, just roll your mouse around your screen. It's usually towards the bottom. There'll be a bubble. And if you could put that resource in there, that'd be great. Otherwise, we'll get it after the meeting. Sorry, John.
No, you actually, you and I are mind melded. I was just going to remind people that there is the chat feature. So glad you did. So now we'll hear from CCEH, and they have some slides that they've embedded into our presentation. Is David on the call, or is someone else taking that?
David's
There we go. Hi, I'm here. Can you hear me?
Yes.
Great. Hi. Thanks, everybody. So we're collaborating closely with DOH. I'll just tell you to advance the slides. Thanks. I've got a few here. I'll try to work through pretty quickly. We are working very closely with DOH on this shelter decompression effort. It's closely tied into the state's Central Command emergency response functions. We're still really focused at CCEH on these three main strategies at the bottom here to decompress the shelters, get to social isolation, and if we could go back to, here we go, and to protect those at highest risk. So we're still focused on troubleshooting exits to housing as well as to spaces like these hotel rooms. So I'll talk a bit in a minute about how we're trying to get that done and stemming inflow. So on to the next slide. Some HMIS guidance. This is from Linda Casey.
I'm here, David.
Linda, do you want to take this one? Thanks.
Yeah, thanks. And sorry, my internet has dropped here at the Casey household with two kids in college who are streaming their online courses, and my husband and I working remote. So hopefully you can hear me. This guidance, we work with DOH to make sure this is the right guidance for how the HMIS shelter enrollments and bed status to be recorded. This guidance that I'm about to say is also going out through both COC email distributions and has been posted on the Housing Solutions Basecamp. So we're trying to find if there's more ways people need to have HMIS guidance communicated, let me know. Those are the ways we're working right now. But the bottom line is for today, for clients who are staying in your shelter, continue to enroll new clients in your shelter and continue to check them in if they sleep physically in your shelter for the dead nights. So if you have folks that are enrolled in your shelter, but they're temporarily staying somewhere else, whether they got a pass to stay with family and friends, or they're staying in a hotel or motel, keep their existing shelter enrollment open, but don't check them in for the bed check unless they're actually physically sleeping at your shelter. And if anybody, so if they're exiting your shelter on a regular, by a regular exit, not for the temporary COVID-19, then just process that exit as you normally would. So I'll pause there. Are there any questions on that?
They can ask you questions. They're all muted, but
Okay.
any questions, they can be, we'll put through the chat room and then we'll get to you, Linda.
Perfect. Thank you.
Great.
Nothing
Thanks,
in the
Linda.
chat box.
So here we go. On increasing exits from shelters, Kara spoke to the shelter decompression effort. We did take a look at shelter surveys about number of beds they've got and their square footage to identify some of the spaces that were most at risk for coronavirus spread. Unified Command, we're looking at approximately 1,000 beds, 500 units. That ask for volume of space could go up based on what we're hearing back from CANS last night and today about their anticipated needs. Apart from the emergency response and looking ahead to housing exits from these spaces and directly from shelter, because we're going to try to ensure we've still got flow through in our system, CCH has approached public housing authorities and some of our professional associations of property managers and owners, and we've started to get, just yesterday, some good responses to that in terms of housing authorities advertising openings to us that we're forwarding along to CANS. As well as landlords who are looking to lease up units that are currently empty. So hoping that we can really ramp that up. And then shortly, we're working with Partnership for Strong Communities to reconvene with people who manage the by name list and the matching meetings in your CAN. We've got a few ideas floating around about how to revisit some of our prioritization criteria and try to ensure that we're making the most effective, the fastest use, if possible, of the housing resources at our disposal of all different resource types. So really trying to focus on the exit side of things as well as on these emergency transfers from shelter into other space. Take the next slide. I'd like you to know that many of the CANs are taking daily calls or at the least weekly calls of the partners on the ground who are most involved in planning around COVID-19 response. So we've attempted to get on the schedule for each of those calls. We will be joining you and just really trying to listen in, gather information about what's happening in each of the CANs, collate that, compare notes across regions, be responsive as you ask questions, and ferry things back up to the statewide emergency support functions when we're hearing down on the ground that there are particular gaps and these things move so quickly, right? We want to try to get that information as live as we can. So these are the staff that we've assigned to be the primary person on those calls in each of your CANs. I didn't get email addresses on these, but please know those are all easily found on our website. Our staff section of our website has the email addresses for each of us. We may be covering for each other here and there. But if you're in this CAN and you've got particular issues, do feel free to email us about that. Primarily, we're calling in to join you on those calls and try to be a liaison up to statewide bodies in between the CANs. And for the next slide, a couple of things looking ahead at inflow. So this is really Mimi Haley, our deputy director, has been carrying this, and Richard Cho talking to the Office of Policy Management. Department of Corrections flagged for us a number of end of sentence clients who sort of fit their profile for most likely to wind up in a homeless shelter after discharge. These are folks they cannot hang on to any longer legally because their sentences are over. They're free to go, but they haven't identified a next space. And Office of Policy Management was able to identify some flexible state monies that could be used to pay for rent for these clients. And we've been approaching rapid rehousing and other community providers about serving even as a kind of informal rapid rehousing program. If any of you are familiar with the Columbus House Rapid Rehousing Pilot that was funded by Court Support Services Division, this is sort of like a quick and dirty ramp up of that effort to ensure that these folks coming out of DOC in the next 30 to 60 days don't wind up in shelters or on the streets. And then today, in fact, Sarah Fox and a number of other partners are joining Yale New Haven Health, particularly in that questions around HIPAA compliant ways for hospitals to signal to shelters that a client who's come into and out of their care has tested positive or otherwise is being treated for COVID-19. We're all just trying to work out how do we trigger our isolation and quarantine protocols and also respect requirements of HIPAA at the same time. So looking forward to some more information coming out of that conversation, which is either happening immediately after this call or this afternoon. I think that's it.
Great, thanks, David and Linda, for jumping on and for doing all that you are doing on the ground. Really appreciate CCEH and all of your staff at this time. Just a reminder, I think, Linda, you might not be on mute. If you could mute yourself. In the Zoom chat, we have an announcement from Terry Nash from CHFA that they'll be releasing an email blast to all of its owners, property managers, and partners seeking vacant units immediately and in the near future for those exiting shelters and nursing homes. And that should go out sometime today. So thanks, Terry, for doing that. The slide that's up is David asking if there's any questions and thanking us. So again, use the chat box, and David's email address, if you want to email him directly, is dgrice@cceh.org. Okay, I think now is a good time to take a breath. So as we did last week, before we do the on-the-ground strategies, I would invite everyone to take a deep breath in and take a deep breath out. Deep breath in. Deep breath out. Deep breath in. And deep breath out. Just remember to do that more than once a day. We don't want people falling over at their desks. Okay, thanks. So Bobby Joe, Mike, and Alicia, are you on the call?
I am here.
Yes, it's Elisa. Yep, I'm on the call, Reliance Health.
Thank you, Elisa. So,
Oh, good.
Bobby, you want to go first?
Sure. So Liz asked me to talk a little bit about some strategies for scatter site. So my case managers work with clients who live in scatter site housing for permanent supportive housing. One of the first things we did was send everybody a letter to reach out to them and let them know that we were going to be pretty much not closing the offices, but starting working from home to begin the, and I don't like saying social distancing, I say physical distancing, because we want to kind of differentiate that we're not socially isolating, we can still talk to people. So we sent everybody letters and we started reaching out. So staff are reaching out daily to clients. One of the things that we're finding is a lot of the people don't have phones. So we're doing what we call drive-bys. And in our drive-bys, we are having people, we're knocking on doors, we're keeping doors in between us. We don't have personal protection equipment, so we're being very cautious about how we're doing this, but we're letting clients know that we're still there. To find ways to communicate with them, leaving them notes if we can't get in touch with them. It's all about keeping that communication open. Meeting them at the park. One of my staff just met her client at the park today, keeping that distance. We're finding a lot of staff, or a lot of clients rather, aren't aware of the situation because they're not watching the television. They're not understanding or grasping the enormity of the situation, so they're still gathering. So we're trying to educate as we go along. But it's just maintaining that communication, that socializing. Everybody's talking about social distancing, and I think that when people hear that, they social isolate, and that's not what it's about. It's about keeping that physical distance, but not keeping that social distance. So we're still telling them, we're here, we can talk to you, we just can't get too close. So that's what we've been really working on. Letting them know we are here. We've been dropping off food from food banks. We've been trying to do as much as we can. Encouraging people to reach out to their families, which has been interesting because a lot of them may have had the family contact. One of the biggest challenges I think we're finding is that we're a very close team and we're not having contact with each other. So I'm trying to bring my staff together. We're doing Zoom meetings. I call my staff daily, I text them, I check in with them. And through this whole topsy-turvy kind of craziness, I'm trying to get them to laugh and to see some kind of a brightness at the end of this long journey that we're on. And I think that's vital to everybody. I know we're all on these calls every day. My calendar's filled with COVID-19, everything's surrounded by this. But I think, just bringing in some laughter occasionally has helped us a little bit. It's been a long week. But I think one of the big things is the self-care that we're doing amongst ourselves. And then bringing that to our clients, reminding everybody to take a walk alone or with one other person at a distance, and just bringing it all together, reaching out and saying, hey, I miss you guys. What's going on? Did you remember to do this? Or how's this going? That's important. I think we're all doing that, and I think we're all doing that in different ways. And I think that's what we need right now, especially the laughter part. So.
Thanks, Bobby Joe. And we're going to suggest when we get a little further down in the agenda that we spend some time next week on self-care and exploring some of those very suggestions that Bobby Joe offered. Elisa?
Yes, I'm here.
Take it away.
Thanks. And Bobby Joe, thank you, because in regards to the staffing stuff, that's just exactly what I would have said. And I think that's just great work, and thank you for that. So in regards to our PATH and outreach teams, we really, our Reliance Health is not having visitors, but a lot of the groundwork is going on. We're making sure that there is one individual in our outreach office at a time throughout the week. I actually just received a call from the soup kitchen before this meeting letting me know there was an individual out in the woods that needed to be checked on, and I was able to call the person in the office, and they'll be heading out there shortly. So communication's been really important for us. We continue to have our housing placement teams, our CAN operations, our CAN steering committee meetings, which I think has been essential to knowing who are the individuals that are in shelter that need to be out and can be housed or above the age of 60. And then talking about the folks that may be moving around encampments or staying in cars and being able to locate them and find them. So again, our engagement, we're just
we're still seeing folks outside of the office, but keeping safe distance. We've been posting materials and information and handing them out at campsites. So going out with that information, asking people how they feel. While supplies last, we bring hand sanitizer. We have a few masks but haven't had to use them or give them out. We haven't yet had to transport anybody, but we're not transporting people either. So we just haven't had to thus far, but it's only 1 week. Where in regards to screening folks, we're asking the questions of have they felt like they had a fever or a cough, and asking them generally how they're feeling, and actually bringing thermometers while they last out with us. But again, everything, knock on wood, has been okay in regards to that. Again, keeping in touch, having our in-person meetings, frequent calls to those, so like other programs and even supportive housing, making a lot of phone calls. We have a lot of staff that are telecommuting, so they're spending a lot of time on the phones with people. We've made sure through the free phones that have been provided that everybody has a phone. So we are able to get in touch with them that they know of, and moving forward as we discover new folks that are outside, we will make sure that they get these materials as they're available. Our soup kitchen locally here in Norwich is allowing folks inside in extreme cases, but typically they're just giving meals out, handing meals out outdoors. But our outreach staff are able to go ahead and grab a meal and deliver it to somebody that may need it as well. People have been really good with that. We also have our own Gem Moran food pantry here at Reliance Health, so we've been giving out a lot of food bags, I think over 100 last week, and we're almost to 100 this week. So making sure food is available. And I've given my phone number out, my cell phone, just in this area to be a triage person while I'm still well, because I can coordinate pretty much anything that needs to happen. So if somebody for outreach or path worker needs assistance, they can call me on my cell because we're not always in the office, and I can triage or call whoever's needed or closest by to check on somebody. And that's, working so far. And then also ensuring clients know the information for NA meetings, AA meetings. Our agency has compiled the list of what's available, the changes in where community food can be given out, where meetings are being held for phone numbers. So we're giving that information out to people too, so they can still feel somewhat connected. And I think having those cell phones is crucial at this time. And again, we're just trying to house any unsheltered persons as quickly as possible. I think things are being triaged in that case as well in this area specifically. So for inspections and whatnot, if folks are matched up with permanent supportive housing, being able to have a inspection done a little faster than it may have been in the past is going to be helpful. So in this area, we seem to be working well. Communicating, I think, is helpful, and staying in touch with folks pretty much is where we're at.
Great, thanks, Elisa. And thanks
You're
again,
welcome.
Bobby Joe. Just for those who don't see the chat box, Kyle says that in regards to tenants without phones, CSH will be sending out a survey shortly to PSH providers to try and quantify the need for phones and other technology needs. And Kim says, our outreach workers are amazing, brave folks. Thank you. So thank you, Kim, for that encouragement. So now let's get into some dense updates from HUD and COC, and the folks from Housing Innovations will walk us through those slides.
Hi, everybody. This is Lauren at Housing Innovations. So we do have a little good news to share today. I'm sure folks have been following what's going on in Congress to try and get a relief bill passed. And due to a lot of hard work on the part of our advocacy partners nationally, there is going to be, we think, there was definitely homeless assistance included in the Senate White House deal. And that, as people probably know, it's not yet officially passed. The House is hoping to pass that legislation by voice vote today. If they are not able to make the voice vote happen today, then the latest news is that it should pass the House on Saturday. And I believe all indications are that it should be quickly signed by the president and official. So good news, hopefully some financial help is on its way. It's going to be, there are a couple different pieces of it. The first piece is $4 billion in ESG, Emergency Solutions Grant money. And other good news is that there is going to be, we don't have a lot of details yet, but that there is understanding that there needs to be lots of flexibility here for localities to figure out, and for HUD to figure out what makes sense. And so for example, we know already that the legislation is going to waive mask requirements, so that's good. It looks like it's going to enable folks to get reimbursed for costs that were already incurred prior to the enactment of the legislation, so that's good news. They did put some flexibility in there, to waive the usual, many of the usual requirements like environmental review and habitability standards and the cap on how much could be used for shelter. We do know that you're going to be able to use the money to do prevention, right, to stop the inflow of people coming into shelter, as well as to, be able to fund flexibly, hopefully, some, non-traditional shelter sites, so including hotels and motels, and that you'll be able to do that for not only folks that are positive, tested positive, but also folks that are symptomatic, and also folks that are at risk of infection and, and vulnerable. So folks that need to be moved out of shelter because they're very vulnerable. So there's lots of good news here. And in addition, there is language there is language in the bill that indicates that HUD is going to be required to continue to focus on housing first requirements. So they're not going to be able to say, for example, that people are required to participate in treatment or other prerequisites as a condition for getting any kind of assistance funded through this assistance. So those are the details that we have for now. Once the bill passes, we at Housing Innovations will get more information out to folks as quickly as we can. It is ESG money, right? And so, we are anticipating that it will be administered through the usual ESG process. So that would be for folks that do not have their own local ESG allocation by DOH for the state. And then I believe it's Bridgeport, Hartford, New Haven, and Waterbury. Someone at DOH can correct me if I've missed anyone that has their own ESG allocation in the state of Connecticut. So this money would be accessed through whatever your community's regular path is for accessing those funds. And I'm sure each of those ESG recipients will put out information as soon as they have it available about how they're going to use this money in your local communities. The other good news that is in the deal, and we have even less information available about this, is that it is going to include some additional $150 billion for what they're calling a coronavirus relief fund. And there just really isn't a lot of information yet about how that's going to be used. We will let you know as soon as we have more information about that. We do know, the one thing that we do know is that there is going to be like a fixed start date on when eligible costs, you would have had to incur eligible costs starting on March 1st. So anything incurred before March 1st would not be eligible from this particular pot. But beyond that, we do not have a lot of detail yet on this. All right. Other news from HUD, people may have seen, this is actually not on the slide because it happened just before we got on this call. HUD did release an FAQ that says that projects can use your project administration budget line item. So if you've got that admin line in your budget, which most projects do, and you haven't already spent all of that money, you can use that money to deliver training for your staff on how to provide services during this crisis. So that is good news. We also have heard, I think they announced yesterday, that the census count that HUD has been planning for people experiencing homelessness is going to be delayed until the end of next month, so April 29th through May 1st. And we're also generally, I don't know if anybody was on the office hours that HUD did last week, they really are signaling quite a bit of flexibility here. So they really want all of the projects to focus on COVID-19 containment and mitigation, right? They recognize that the most important thing we need to be doing right now is keeping your clients and your staff and your community safe, and that they will consider that strongly in future monitoring, is what Norm said. So, and they are working actively on waivers to usual requirements like HQS. So they said on last week's office hours that they understand that HQS is not always going to be feasible in these extraordinary circumstances, and that projects should continue to provide assistance if HQS is delayed. They also said that using creative strategies like FaceTime in order to do HQS remotely, that projects should do those things. And they have not yet released the official guidance on HQS, but they are definitely signaling, please go ahead and assume that you can continue to provide assistance even if you've not been able to do the annual HQS. So they also suggested that if your project needs to deviate from your usual practices during this crisis, that you make a note in your project files explaining what you had to change and why you had to change it in order to keep your clients and your staff safe, and that would be your documentation that you would then provide in future monitoring. They've also said that if you need a budget amendment, right, you need to move more money into social services out of rental assistance, for example, that you can, that you should contact your, the Connecticut field office, and they will be expediting those requests. And there's more information also on a lot of these things. The CT BOS team has been compiling a frequently asked questions document that is up on our website, and we will be updating that every day or every couple days as new information emerges. So please check that FAQ document for for details on some of what I'm talking about. And then finally, HUD has indicated that they are working on, they recognize that the NOFA would be an incredible burden for providers and COCs at this particular time. They want folks to be able to focus on, all this incredibly important work that you are all doing around COVID-19. And so they are trying to figure out what to do with the COC NOFA, but we do anticipate that it will not be business as usual, and are very hopeful that the NOFA will be far less burdensome in this coming 2020 cycle than it has been in the past. So we don't have any concrete details on that, but we will certainly get that out to you as soon as we know anything. We have found, I don't know if folks are seeing, I know people's inboxes are absolutely inundated with COVID-related 19 information. HUD has been releasing this daily digest, which is, I find it to be very helpful. They're calling out what's new that's been put out there nationally, both by the government, various government partner agencies, as well as by various communities that are dealing with the crisis and sharing tools and resources. So if you're not getting them, you should just register on the HUD Exchange for the COC email list, and there's a link here on this slide where you can access that daily digest as well. Okay, so we are going to, and part of what we want to do today is to hear from you guys about what is going to be most helpful for you in these calls in the coming weeks. We are planning, as long as people are still finding them useful, to convene these calls weekly in the same time slot. And we want to know what information we can provide to be most helpful to you. So I'm going to initiate a poll here and ask you guys to let us know which of these things is most important to you. And you can pick up to 2 things, whether you'd like to see us in these calls continue to provide information from state agencies and our statewide partners like CCH and others about the status of the COVID-19 response, whether you think we should focus on the ground strategies like those we heard today from Bobby, Joe, and Elisa from providers, and whether you think that having time to talk about what your team is struggling with and to get support and suggestions from your peers, which of these things is most critical to you. So we'll give people a few minutes to respond to those questions, and then we'll share the results.
Great. So folks who are on the Zoom call are watching in live time the responses, which is wonderful technology. So as you're considering your answers, 39 out of 78 have voted, 50% so far. I just want to acknowledge that Alana Cable from the HUD field office is on the call with us. And I know that she and her staff are so appreciative of all the work that you're doing on the ground. I'm not sure if we can unmute her or not, if she wants to say a few words, H49145. But if we're not able to get her to speak directly, I know that I can speak on her behalf to say that she's 100% behind all of our efforts.
Hi, John and everyone.
Hey,
good
Alana.
morning. This is Alana. I hope you're all doing okay today. The sun is out, so that's always a good thing for all of us. But thank you, just to reiterate what John said, for all the great work all of you are doing throughout this unprecedented time. Just to update you on, what I know with regard to the stimulus package, as Lauren has said, it hasn't been voted, it hasn't been finalized yet, so we don't have a lot of detail, but HUD's intention is, as soon as it's finalized and the information is sent over to headquarters, the Office of Field Operations is hoping to have a call with all of the CPD directors in the country and the program offices next week once they get details on the stimulus. So I would hope that after following that call, I'll have additional advice and guidance for all of you. They did bring up a couple of items on the call. The SNAPS office did join us for part of our director's call yesterday. A couple of questions that they've been hearing, and you may have discussed this previously. I apologize if I'm repeating something that you already know, but incentive pay, that is pay to allow for providers to pay more than normal rates in certain circumstances, is allowable under 2 CFR 200.430. It is something that should be in the grantee's policies and procedures. If you don't have it in your policies and procedures today and you find that's something that you need to do, if you can just draft what you'll be adding to your policies and procedures, send them to me or to your CPD rep. We'll take a look at them, and headquarters, as long as they're in order, they're approving them as like special disaster policies and procedures. So if you find yourself in that situation, there is a way that we can help you. The extension on 90-day post-expiration period draws, we do have the ability to do extensions into that for that, and SNAPS is looking at preparing a memo for us on that. I don't have it yet, but we have given the green light that we already have the ability to provide those extensions when requested. With regard to the HQS inspections that Lauren brought up earlier, again, the SNAPS office is saying stay tuned. To your point, Lauren, everyone should listen to their public health officials and not do anything that would put anyone at risk. They are hoping to get what they're informally calling a mega waiver out either today or next week, which will address inspections, and that's, you know, if the mega waiver gets through, but they are doing everything they can to advance that. We don't have an answer for you yet on review of first draws on a new grant. They are aware of that. They're looking into it. Just don't have any advice and guidance for us yet on that. So those were the big topics with regard to SNAP that were brought up on yesterday's director's call. And as I get more information, I'll certainly be happy to share it.
That's great, Alana. Thanks so much for jumping on and sharing that good news with us. So it looks like all the folks who were able to vote have voted, and overwhelmingly, it looks like information from state agencies and partners about the status of the response and available resources is where you want to focus our time and energy. So we will continue to use the format that we're using today for next week. So the slides after this current slide.
John,
yes.
John, we have one other poll that we were hoping to get feedback from people on some topics for next week. So I'll do that quick.
Oh, that'd be great.
Is that okay? Okay.
One moment, please. There we go.
There we
While
go.
we're
You guys
waiting,
seeing it?
oh, I just wanted to call out, sorry, shout out to Alana. If you could type in the number of that reg you cited, a couple of folks have asked in the chat box. Sorry, Lauren.
Oh, no worries. So this poll is asking people to tell us which topics you are most interested in us trying to cover in future webinars. So please weigh in, and we'll give you a minute to do that.
Just a reminder for folks who are only joining us by phone, everything that we've presented and the chat room will be recorded and sent out. And any questions that aren't answered today will be answered in and put up on our website. So.
Also, oh, sorry, John.
Go.
Also, if there are topics that you are interested in that are not in this poll, please put those in the chat. Let us know how we can be most helpful to you in these weekly calls.
So as you are voting, the future slides that we have are similar to last week's, which are the takeaways for delivering services as much as possible, adjusting without reducing, things that you're already doing on the ground, and then some slides for taking care of yourself, some warm lines, and the resource links, and then finally a reminder that we'll send out again as a calendar invite that we will meet again next Friday, the 3rd, and that any questions or requests, let us know, and we'll structure that meeting to accommodate any arising concerns that we have not yet anticipated. So we'll get those out, and again, just want to thank you guys for sticking with the folks who are most at risk and vulnerable every day, and now on top of it, you and they are facing this unanticipated pandemic. So just be kind to yourselves, be kind to those that you interact with, and we'll get through this crisis just like we have every other crisis. So, Lauren, do we have some answers?
Yep, I just shared.
Okay. So the one in orange is meeting the unique needs of people with serious mental health illness is an overwhelming response or request for that. So that will be one of the foci of next week's meeting. Folks, it is now 12 o'clock. I know you guys are busy and probably hungry and thirsty, so go take care of yourselves, and we'll meet back here next Friday at 11. Take care.
Thanks, John.
Bye.
Thanks, everybody.
Thank you. Bye-bye.
Thanks, John. Bye.
Bye.
Thanks.